Welcome back. It's still March 11th. We're pivoting to H 816 and we have legislative council with us. We'll mark up and possibly asking questions. We're also going to hear a little additional testimony. You want to come on up? Sure. I hear Brian.
Hey, hello.
Hello.
Hi, Katie. Good afternoon. Katie McLean, Office of Legislative Counsel.
We're so glad you're able to see you.
Oh, good. Well, I'm glad I'm able to be here too. Which bill would you like to start with?
Let's start with 816. And just to be clear, we only have you until 2:30 max, right? You have to be somewhere.
I think I could go over a little. Let me check my calendar.
Trying to really be respectful of yours and Jen's time.
Thank you. Okay. So I've just pulled up the latest draft of H 816, which is the AI bill. And I have some changes highlighted in yellow that were requested. I also received an email from another committee in the building that was interested in aligning definitions of AI. So we could look at those also if that would be of use.
Right, that's just flagged for me.
Yeah, like 3 minutes ago.
I had a conversation with them.
Yeah.
Okay.
And I think we had talked about that because we know that there's lots of AI bills and there was one committee that was sort of taking the lead on let's define so that we didn't have 47 different.
Right. Within our office, we sort of had a conversation before the session started about, is there a prevailing definition we should use? And we thought we'd let the process play out. And it seems like that is what is happening. So,
Can you share which committees we're in?
Yes, I had a conversation. I met with Monique, Commerce. Okay, thank you. I'm also, let's talk about it when we get there.
Okay.
okay. Do you want a review of what is in the bill generally? And then, or do you want me just to bring you to the changes? What works best?
I would love a review.
A refresher. Okay. So the first part of this bill is a purpose section. Purpose to safeguard individuals seeking mental health services in Vermont by ensuring that therapeutic judgment, clinical decision-making, and therapeutic communication remain the responsibility of qualified mental health professionals and are not delegated to AI systems. Respecting individual choice and selecting mental health services, including community, peer, and faith-based options, and allowing the responsible use of AI for administrative, operational, documentation, and quality improvement functions that support access, efficiency, innovation, and mental health services. So those are our purpose sections. In section 2, this is a section that governs unprofessional conduct for many professions, and there's a list of what constitutes unprofessional conduct, and what is being added to this list is that for mental health professionals, the use of AI pursuant to the section that's being created in 7101. Then in Title 18, we have a section that's being created about prohibited uses of AI. We have a definition of AI, which I might just skip over for now and have that conversation later. Same thing with generative AI. I'll just skip over that and we'll come back to it. You have a definition of mental health services. Means
That's in our jurisdiction.
means support, counseling, therapy, or psychotherapy services provided by a mental health professional to diagnose or treat an individual's mental or behavioral health, or provide ongoing recovery support, excluding religious counseling. A definition of therapeutic communication, meaning written or spoken interaction intended to diagnose or treat any type of mental or behavioral health concern. Provide ongoing support, provide advice related to a diagnosis, treatment, or recovery. And then in subsection B, we have language that prohibits a person, corporation, or other entity from offering, providing, or advertising mental health services in the state that represent AI as providing therapeutic judgment, diagnosis, treatment, or therapeutic communication. Nothing in this subsection B is to prohibit the use or disclosure of the use of AI for administrative, documentation, operational, or quality improvement purposes when a mental health professional retains clinical responsibility as authorized in the section we're going to look at next. And then a violation of this section is enforced under the Consumer Protection Act, and this by the Attorney General's office. And this is language that is fairly standard throughout statute with regard to the Consumer Protection Act. Okay. Section 4. This is now in Title 26. So we were in 18, we were adding this language to the part of Title 18 specific to mental health services. Now we're in Title 26. This is specific to a professional regulation. So adding a new chapter or creating a new chapter about artificial intelligence and regulated professions. The idea being that there may be other professions at some point that have statutory language added specific to AI. So we have a general subchapter that's being added. And in this case, we're only adding definitions of AI and generative AI. Again, I'll skip over those for the time being. And then in subchapter 2 of this new chapter that's being created, it's specific to mental health professionals. So we have definitions, including a definition of administrative support, means a task performed to assist a mental health professional in the professional's delivery of mental health services, such as scheduling, billing, and general logistics, but excluding therapeutic communication. Definition of clinical responsibility means the duty of a mental health professional to review, approve, and remain legally accountable for any use of AI in the provision of mental health services. Consent means explicit affirmative act by an individual that communicates in writing, voluntary, informed, and revocable agreement. Consent does not include acceptance of broad terms, use agreements, passive agreements, or deceptive practices. We have a list of who is a mental health professional under this chapter, and it's very broad. Licensed, certified, and rostered individuals that provide mental health services as a physician, as an APRN specializing in psychiatric mental health, psychologist, peer support provider, peer recovery support specialist, social worker, alcohol and drug abuse counselor, clinical mental health counselor, marriage and family therapist, psychoanalyst, an applied behavior analyst, and a non-licensed or non-certified psychotherapist, non-certified psychoanalyst, and any other profession that provides mental health services.
Yeah, question, clarifying.
Sorry, go ahead.
I'm just curious about on line 3 or 2 and 3 when it says physician. Does that mean psychiatrist or not necessarily?
Provide mental health services as a physician. Yes, it would include, but I think it's broader than that.
That's good. I was interested because all these other ones are very specific
Mhm.
to the training of mental health, and I
Mhm.
didn't know how that works out.
It would certainly include psychiatrists, but I think it could be read broader than that.
Yeah.
Mental health services means support, counseling, therapy, or psychotherapy services provided by a mental health professional to diagnose or treat an individual's mental or behavioral health, or provide ongoing recovery support, again, excluding religious counseling or peer support. And then we specify that peer support here means support services provided by an individual with a lived experience of mental health or substance use disorder who is not one of the certified individuals addressed in the mental health, the definition of mental health professionals. We have a definition of religious counseling, counseling by clergy, pastoral counselors, or other religious leaders acting within the scope of the individual's duties if explicitly faith-based and not represented as clinical services. Supplementary support means a task performed to assist a mental health professional and the professional's delivery of mental health services, excluding therapeutic communication and administrative support. Therapeutic communication is the same that we've already gone over in the previous section. And then there's a change here to add a definition of therapeutic decision. So that would mean the final clinical determination regarding diagnosis or selection, modification, or termination of treatment or care. Therapeutic decision does not include algorithmic risk scoring, data analytics, or other clinical decision support tools when used under the supervision and authority of a licensed mental health professional. And then in B, permitted uses, this allows the mental health professional to use AI for administrative support, supplementary support, and operational or quality improvement functions, provided the professional retains sole responsibility for therapeutic decisions. Permitted uses include scheduling, billing, coding, and claims processing, transcription and documentation support with patient or client consent, preparation and maintenance of clinical records, the identified data analysis for quality improvement, and workforce capacity planning where the mental health professional reviews, modifies where is necessary, and approves the final product. Under confidentiality, in subsection A, administrative support and supplementary support tasks conducted using AI, like transcription and recording, are subject to privacy protection prohibitions in statute. And in subdivision 2, consent by a patient or client is required when AI is used to record identifiable therapeutic communications. Under subsection D, prohibited uses, mental health professional shall not use AI in a manner that allows the artificial intelligence, I don't know if it should say system, or just artificial intelligence, allows the artificial intelligence to independently make therapeutic decisions, independently diagnose, independently determine treatment, or independently generate treatment plans. Nothing in this subsection prohibits the professional from disclosing or describing how they use AI for administrative support or supplementary support to prospective, current, or former patients and clients. We've already hit on these exceptions a couple times, but this doesn't apply to religious counseling, peer support by somebody who is not a certified peer support provider, or generalized educational and self-help resources that do not purport to offer mental health services. And this takes effect on passage.
Thank you, Peggy.
Thank you.
Questions? Nancy?
Katie, I have a couple. One is on page 9, line 3, peer support is accepted. But on page 6, line 5, mental health professional includes peer support provider. Is that going to cause any problem?
Peer support, wait, 6, line 5. So if the person is certified under chapter 60 of Title 26, so if they're certified peer support provider, then this does apply to them. If they are somebody who is not certified, this does not apply to them.
Got it.
Okay.
Do we need to work in a place for the new emergency response peer specialists? Is that an official title?
They're
or
not
just certified?
certified, right?
Potentially somebody could be, but not necessarily. That feels so niche that I tempted to exclude them.
Wouldn't they fall into one or the other here? At the emergency? Would they either be a certified, in which case they're covered, or not? Or
So they wouldn't be covered,
Yeah.
they wouldn't be certified pursuant to chapter 60 or article.
They could be. Somebody could be, but not necessarily. We don't know who exactly is providing those services. That's why we came up with this special term that was
Right.
unique to them. But potentially somebody could be certified and working in that field, or they might not be. So I guess that is probably a correct assessment, that either they are certified and then this covers them, or they're not certified and then this doesn't cover them. But if you specifically, some of them are not mental health. Sorry, I'm kind of thinking this out loud.
Yeah.
Some of the people in that bill don't have any special clinical training in mental health. So maybe it's not appropriate to lump them in with people who do have these clinical training.
And they explicitly do not provide mental health care to each other. They just connect each other to resources.
Okay.
If you don't think it's going to be a problem, That's fine. Point it
It
out.
doesn't feel like it will be a problem. I think if you are concerned and the decision is to carve them out because they're not mental health professionals necessarily, you could add them in section on page 9. But that bill hasn't passed yet, so that term actually doesn't exist yet.
Can okay, yeah, if you don't think it's a problem, I'm not gonna,
Okay.
and nobody else does, but. Page
Should be using AI.
line 11. You refer to qualified mental health professionals. Are we using that as like QMHP? Is it an official
Mm,
title?
yeah, that's a good question. Let me think about that. Ensuring therapeutic communication. Remain responsible. That is a good point, because that means something very specific. It doesn't, I mean, this is appearing in session law and it wouldn't necessarily track with that language in Title 18. But I think maybe striking qualified and just saying mental health professionals makes more sense and is less confusing and tracks the language in the bill.
And
Should I go ahead and, well, I'll just mark it up here.
and then the chair made a comment to me before leaving, questioning the use of the word behavioral health, which
Mm.
for the record, I have no problem with. I think it's correctly used.
Where is that used?
It's used on page, I think it's 6, line 17 on page 6. That's one, I think it might be somewhere else too, but I know that's one.
A mental or behavioral health concern.
It's used with the way that we've defined it in
I
statute.
have to go back to that definition. Yeah, I guess it's not trying to be a replacement for mental health. It's recognizing that there are maybe different things that could be falling into those buckets. Let me just pull up the statute.
Oh, it's also on page 7, line 9.
Is it that word you're worried about?
I'm not worried about it.
Not you. Are you worried about someone else being worried about it?
No, the chair noted that the term was used and asked whether we needed that.
Okay.
I have to think about taking it out.
So we have a definition of behavioral health. That means any behavioral condition bearing on health, including stress-linked physical symptoms, patient activation, and health behaviors that can be addressed through support counseling, change techniques, coaching, and other interventions. As used in the VSA, the term does not include mental health conditions or substance use disorders. And it goes on, but it seems like it's creating a distinction here between behavioral health and mental health. So by using both in your bill, you are capturing anything that would fall into either bucket.
I think generative AI on page 3, line 1 is the only other thing. And
Mhm.
as we mentioned, there in the Commerce Committee is a bill that we should align with if they've passed it already. I think there was an additional testimony that we received recommending that we align with it was on H14, recommending that if we use terminology that we align with nationally recognized terminology by some entity. I don't
I'm trying to
remember.
remember it too, but it's a national entity that comes up with labels for technological standards. It's like Nesty, or so. I'll look it up, but I know what you're talking about.
Yeah, but for now, I think we need to align with whatever Commerce has passed.
So this email that I received said that California's definitions are generally being copied across states as the national standard. And I'll just read you what the AI definition is in the generative AI. So AI means an engineered or machine-based system that varies in its level of autonomy and that can, for explicit or implicit objectives, infer from the input it receives how to generate outputs that can influence physical or virtual environments.
Great.
And then generative AI system means an artificial intelligence that can generate, derive synthetic content, including text, images, videos, and audio that emulates the structure and characteristics of the system's training and data. So I guess my question after reading this email is the suggestion that we copy California? Is that what is being suggested, to use California's, or do they have a variation?
Has Commerce said they're using California, or are they still coming up with their own?
I'm asking AI.
Well, this email doesn't feel totally clear to me because it says definitions for comparison. Oh, wait, it looks like they are using the California in that one.
Wait, I have it written down. It's the bill that we were asked to.
Okay.
We're asked to use the definition for generative AI from H8211.
Okay, so that tracks what I just read, the California one, but the AI one. Does
Do you know
that
what-
track
You
also?
know what California bill, this step? Do you know what California bill, the definition comes from?
This says it's in the business and professions code.
This
I do have the section number if you wanted to look it up, California law.
This email is very unclear on what they want us to use.
I'm thinking it's California, but I feel like we maybe need a confirmation on that.
According to AI, California increasingly uses NIST, which was the definition I was talking about, and that's why I was gonna actually check myself.
Oh.
But maybe we could just look at NIST definition in California's, and if it's the same, then that's what they're talking, you know?
Who is this email that you all keep referring to?
It was from the Commerce Committee.
Well, I met with one of them and they told me to use the definition as they used in
Yes,
Whatever, 11.
which, yeah, it's a very long email that gives multiple different reasonings. I'm trying to come up with in the email what their conclusion is. They do have definitions for comparison, where H816 and 211. But they don't give an H211 definition of generative AI or artificial intelligence.
Do you mind if
I think that we need clarification. Do we have a problem with the definitions that they're using?
No, that's why I said we should just look at the bill that they said we should reference and figure it out. And I don't think we have to resolve it right now. I think I can get with Katie and make sure that we're aligned with what Commerce did.
Okay, that means that we will not be able to vote on this bill.
I can email back right now and just ask, confirming that this means you'd like us to use the California definitions. Is that
That would be great.
okay?
I bet by the time we all ask our questions, we'll have an answer and then we can vote on it,
Yeah.
hopefully.
So while we get a confirmation on what definitions they would like us to use, does anyone else have questions? Go ahead.
I want to let Katie finish typing and then I'll ask, because I know what it's like to be bombarded with things while trying to do something. I'll give you a second, but I'll be ready to ask as soon as you're ready.
Don't doubt it. Let's see. Okay.
You sure?
Yeah.
Okay. So there's two main things that feel unresolved to me. One is in the confidentiality and consent section, it says administrative support and supplementary support tasks conducted using AI, including transcription and recording, shall be subject to disclosure prohibitions in 18 VSA, and then it has sections.
Mhm.
And like, I could look those up, but I probably still would need to check with you. So I figured I would just ask you, like, do providers have to tell patients how the data is being shared by the vendors that they work with? And do the patients have to consent specifically to that sharing? Or are we creating a situation where people are going to be unwittingly having their information shared between companies and stuff so I don't know what those disclosure prohibitions are. And even if I look them up, I'd probably need you to like interpret it. So
Yeah, so
I'll give you a second. That's my first, then I have a second separate question.
I do have one. Okay, I have the sections. I have to review them again.
Okay.
But also there is that, I only have one of the two. In subdivision C2, you see that you asked sort of about patient consent, and there is patient consent required for recording
It's required to record, but what is
Whatever-
unclear is
about everything.
providers have to disclose to the patient how data is shared, because that's with the state inventory of use of AI. There's this, and this is, I brought this up before with the hospital, like, and they were gonna look at it. There's an inventory where you see exactly how the data is shared, you learn how these machines are learning, like all this info is available to the consumer. And this way, like, okay, when the provider also understands how what they're using is mining the data of patients, even if it's not publicly sharing it.
So this bill doesn't address that.
It doesn't.
No.
Those sections, okay.
No, because that would be addressing the data, like data that.
It does. It's about data
collected,
protection in
and
the
that
healthcare
would-
system.
814 would be a better.
Yeah, or it might be covered by HIPAA. Like, this is the thing. So like, I
Yeah,
just,
this is not.
but I do think patients should be informed if their data is being shared. And in the healthcare system, like, this just reminds me of opt-in, opt-out, where like people weren't opting in. So we made it that you have to opt out. And then I learned that providers don't even give people that choice. They don't tell them. So now everyone's getting opted in to Beehive, or not Beehive, what is it called? Vital. And so like, I'm concerned here that it's not like an obstruct, I'm not gonna like make me oppose it, but it's a thing that stood out, is like, it's unclear how people's data will be shared. And we may not resolve that right this minute.
Yeah, I think you're asking a bigger question than I can
Okay.
answer just sitting here.
So like, we'll let it go for now. And then the other thing is, why are we only doing this for mental health? Because, yeah, and so I'm not opposing mental health, but then I read it, I'm like, shouldn't all healthcare follow the same standards here? And that could be a simple thing, like we just say healthcare, and because it also doesn't say substance use, but then there's providers in the listing who are substance use disorder treatment providers. And so it's like, well, maybe that's covered by mental health and behavioral health. But I mean, I think the bigger issue is parity. Like, wouldn't it just be that in the healthcare system, we have consistent standards of how we protect people from AI and also allow it safely? And I'm not saying we have to do it today. It could be a simple change we make, or it could be something that we do later, but it stood out to me.
Can I answer that or respond
Yeah,
to
of
that?
course.
So the intent of this was to focus on mental health for a reason, and it's that with this topic being, as you appreciate more than a lot of us, being a complex and rapidly evolving one, I think we need to look at this practice specifically, also because of the urgency with incidents of suicide. I wanted to focus a bill specifically on mental health so that we could do this right. And if there's an opportunity to on it and extend it across other services, then I think that's fantastic. But I want to get it right for mental health, and I want to get it as soon as possible.
I hear that because the chat bot thing is real. It's like real. There are people dying because of that. So like, I get that. It just, the two things that stood out in this final reading was, like data protection and parity. And so it's just, that's what my questions were around.
I think it's a great question, and it would open up lots of other things. And I think that right now we're just down to time. Fortunately, I think it's a great question though.
And speaking of time, I'm going to take this opportunity to let you know I have to go to appropriations in 10 minutes for 8:14. So when I leave, I'm not going to say anything that I'm just going to sneak out and come back.
Yeah. You're sitting in your correct spot.
On page 8, at the bottom, section 2, it says nothing in the subsection shall prohibit a mental health professional from disclosing or describing, and administrative tasks are one thing, but the supplementary kinds of tasks seem maybe more substantive, and I just was wondering why it was like nothing prohibited, or is that an important disclosure piece or not in this context?
I'm not sure I completely understand the question. You rather have it say you have to disclose rather than there's nothing prohibiting you from disclosing?
Well, we are in this disclosure section, and if we're choosing not to, I'm just wondering why. I read the definition, but what
That's supplementary.
Yeah, it seems like it could be a little more substantive. And it seems to be using AI in a substantive way. That's something you might want to be disclosing, but okay, I'm just.
So supplementary means a task performed to assist a mental health professional in the professional's delivery of mental health services, excluding therapeutic communication and administrative support. And I'm sorry, I'm not fully understanding your question. So you want to know whether there should be a requirement to disclose that? I think that's a policy question. Not a very helpful answer, but
I'm just wondering about the policy.
Am I reading this correctly in that we're just basically saying that if a mental health professional wants to disclose to
Mhm.
prospective, current, or former patient or client that they're using it for administrative purposes, there's nothing in that this bill says that they can't do that.
Right.
Yes.
They don't have to do
They
it.
don't have to do it.
and I think some of it, well, let me, before I say that.
Administrative, I'm very well, that's okay, but the other part, I don't know enough.
Without knowing how the data is shared, like, you don't.
So if you look at page 3B, it says a person, corporation, or other entity shall not provide, offer, advertise mental health services in the state that represent AI as providing therapeutic judgment, diagnosis, etc. I sort of wonder if that language that you're talking about is meant to be sort of the counterpiece to that, to say like, a person who wants to say I'm using AI isn't running afoul of advertising, or, their comments about their use of AI, shouldn't be seen as a violation. Maybe that's a little bit of a stretch, but
Where are you referring to? I'm lost.
HCB.
12, line 12.
Yes, Katie, I remember when we were originally drafting it, I was like, I want to be really, really clear what's permitted or what's prohibited and what's not prohibited, because clinicians need to be clear, and then we need to be clear what is AI and what is allowable as therapy and not. And I think you're right. I think that was it makes sense to me that it tracks with just making it crystal clear. Is that what you're getting at, Karen?
It's that, I don't know, that I don't know the field as well as you, so I was just wondering about it. The language, the B here doesn't include that supplemental. Supplementary support. Supplementary support. It assists the mental health professional in the delivery of mental health services. So I don't really know. I just read.
So supplementary support is like something that's assisting you with note taking.
That's what.
Something assisting you with note taking.
Oh, no, yeah.
Or billing.
Yeah.
Or
Administrative.
Administrative, yeah.
support.
Okay, just asking.
Topper, do you have a
That was
question?
it. No, I just.
Oh, you got it. All right. Okay, so any other questions? We are going to go to Lynn Courier. Do a little additional. Hi, Lynn, how are you?
I'm doing well. How are you all doing?
Great. And Katie, had you gotten a response yet?
Yeah.
Oh, you did. Okay, so maybe Katie can. Okay. Thank you.
Thank you, Katie.
Thanks for joining us today.
Thank you for having me. You ready for me to jump in?
Oh, just jump right in.
Okay. Well, my thanks to the committee for hearing my testimony. For the record, my name is Lynn Courier. I am the Executive Director of the National Association of Social Workers, Vermont chapter. I am also the Executive Director for the New Hampshire chapter. I'd like to begin by thanking you for taking up this extremely important issue. NASW Vermont supports the passage of H116. The primary concern of NASW Vermont is AI platforms, including generative AI, providing therapy or mental health services independent of trained licensed mental health professionals. This is an issue that's being addressed in many states as we speak, with legislation that has passed in Illinois and Nevada. If you ask AI if AI should be providing independent therapy, AI will tell you no. We've asked. And if you ask AI if you have a certain diagnosis and lay out some symptoms, the response will be that it can't make a diagnosis or treatment plan, but then it will. At best, AI therapy platforms are the unlicensed practice of mental health care. At worst, the interactions are harmful and misguided, and in some cases have ended in self-harm or suicide. We have a growing number of examples and lawsuits of AI platforms expressly or by default providing therapy with tragic results. The one that truly breaks my heart is Adam Rains, who is a 16-year-old boy who died last year by suicide. ChatGPT provided help and resources on how to tie a noose that would hold a human body. And of course, it could help with a heartfelt suicide note. AI is designed to be helpful. It is designed to provide resources. It is designed to share information in a friendly, non-judgmental way. But it lacks the critical thinking and analysis of human professionals. AI pulls information from recorded therapy sessions. This is what it uses to create predictive responses. In other words, if the AI system has learned, and I put that in quotes, that people in response to feelings of depression cut themselves, this becomes the norm and the recommendation. AI is pattern matching. It is not deep understanding. Mental health professionals undergo education, ongoing training to achieve their licensure and maintain it. Artificial intelligence should not be allowed to provide services that require this licensure. We understand that the need for mental health care in this country outpaces our ability to adequately meet the need. However, AI therapy is not the silver bullet that we're looking for. The risks towards consumers are too high, and the safeguards are not yet in place to provide confidence. The data on the effectiveness of these tools remains hopeful, but really falls short of truly being called an evidence-based practice, which is what we require of our mental health practitioners. So thank you for hearing my testimony. I'm very happy to answer any questions that you might have.
Thank you so much, Lynn. We really appreciate your testimony on this, reframing and getting us back to what we're trying to do here. Any questions for Lynn? Go ahead.
She sent in her.
Oh, would you send in your written testimony?
I certainly can, yes.
Oh, that would be, yeah, we'd love to refer back.
I'd be happy to.
Any other questions?
Yeah, I guess so.
Yep, Alan
I
does.
guess, I'm trying to keep track of what you're saying. So overall, you're not supportive of this bill, or are you supportive of some of it?
No, we absolutely, we support the bill. Our primary concern is about these AI platforms that are putting themselves up as an equivalence. So, I mean, you can go on to these sites and they say, oh, you can do like $17 a month. If you had a psychologist, it would cost you this much. If you had a social worker, it would cost you this much. They're putting themselves up as an equivalency, and it's happening not connected to anybody who's licensed or actually has training in providing therapy or differential diagnosis or treatment plan creation. That is the top note. What we are most concerned about is these platforms that are selling themselves as therapists or by default acting as therapists. So short version, we're in favor.
Great. Go ahead, Val.
This is silly and small. I don't know if you referred to the bill, just so you don't have to correct it when you do send it to us. I don't know if you said 116. I just want to make sure your testimony said 816.
Yeah, I think when you started, you said H116 and it's H816. But I just assumed that.
My mouth got ahead of my brain. I will make sure that is correct in my written testimony.
Great. Daisy?
Lynn, thank you so much for joining us and sharing your expertise as a social worker and someone who really will be instrumental in implementing the policies that this bill would introduce. I think I would just note that when approaching Ledge Council for how to mitigate this issue that Lynn articulated so well, we contemplated how basically like blunt of a tool to really regulate the AI risk to the general public. And I think that Ledge Council did a really eloquent job with it in terms of clarifying specific things like clinical responsibility and noting where that is required and that it includes review and approval by a clinician. And so we're not only, protecting individuals from the harms of things like chatbots, but also we're protecting the quality of care that folks like yourself provide in Vermont. Also, I would just note that we had testimony from someone who highlighted that there's a lot more nuance to the risk that those chatbot type situations you talked about pose to us. And I've talked with the chair of Senate Health and Welfare downstairs, and they can take more testimony in detail on this as the bill moves forward, because we recognize that it's a much bigger issue than we have time to really comprehensively address in this session here.
Or in this house at this moment.
Yeah.
But we are having good discussions with counterparts in Senate Health and Welfare when it moves to that. Thank you. Thank you so much for your testimony. Katie, do you want to come back up? You've got a new version?
Yes, and I have a new question out to the.
Great. May I ask, and I know that this question was asked and answered, but I just wanted to clarify, and I came in late, and I apologize. I forgot I had to be in GovOps on that amendment. So I had to go to GovOps real quick. The behavioral health, is it absolutely necessary?
So we looked at the definition of behavioral health in statute, and it distinguishes behavioral health from mental health services. So to the extent you want to cover both, you would name both.
Okay.
Yes, you haven't made any changes, but I put them in. Let me pull it up. Okay. So this is a draft 2.1. And the change you're making is this definition of AI. So we got a confirmation to use California's statute. The question that I'm wondering is this term generative artificial intelligence isn't used in its own right in the bill. It's only defined because the original version had this sentence, artificial intelligence includes generative AI. So my question was, is that accurate? Because it's not part of the California statute. So I'm sort of waiting to hear, and then depending on what they say, you might have to make a decision whether to cut generative AI or every time you use AI to put both. I'm not quite sure how you'd want to handle that, but that's what I'm wrestling with.
So are you waiting for an answer from somewhere else?
Yeah, I just emailed.
Well, how about, unless anyone has any other questions around this particular bill, how about we switch bills while we're waiting for an answer on that? We have both 816 and 817 warned for votes only because Katie has been very, very busy with human services and it's been difficult to get her in, but we don't have to get these out today. We can try to find short periods of time before Friday to vote these out. If need be.
I learned that we will be, there's a class, a high school class that is going to be submitting written testimony on this bill. They're focusing on it. And so on Thursday, we're going to get some written testimony from some high schoolers on this. I just want to let folks know.
This is
Yeah,
the 817. Or 817 or 816?
817.
817. Okay, let's move to 817.
Okay. So here's your amendment.
We did try to get them in, but apparently they were all on school break and
So there's no highlighting in this draft because it's a rewrite. So I think you should maybe just come to this with fresh expectations. This is in Title 18, which is our health title. It's adding a new section, mental health literacy and peer support initiatives. First, we have a purpose section. This section aims to strengthen protective factors among Vermont's youth, increase mental health literacy within school communities, and expand access to developmentally appropriate peer-to-peer initiatives that promote early identification of mental health challenges. And then we have a section on mental health literacy training. To the extent funds are available, including through federal block grants, a public school may apply to DMH or DMH's designee for a grant to provide mental health literacy training to educators and other school personnel. Mental health literacy training shall include topics related to working with youth in an educational setting, such as information about mental health conditions and symptoms, understanding common youth mental health and substance use challenges, reducing stigma and promoting supportive school environments, strengthening protective factors and help-seeking behaviors, recognizing risk factors and warning signs, responding to students with empathy and appropriate boundaries, information about mental health treatments, and accessing mental health resources or services throughout the state. This section shall not be construed to require the adoption of a specific curriculum or instructional content. So if you remember, the lead in here is such as, so these elements could be part of a training, but don't have to be. Subsection C, peer-to-peer mental health support. Changing gears, instead of literacy, this allows a school to establish a peer-to-peer mental health program that provides structured opportunities for student peer connection in a supervised school setting. A program that is overseen by a designated educator or school personnel member who is not required to be a licensed, certified, or rostered mental health professional under Title 26. And emphasizes school and community-based resources and how to access professional services when additional support is needed. At the top of page 3, DMH is to provide oversight and guidance to any schools seeking to establish or maintain a peer-to-peer mental health program. In subdivision 3, a peer-to-peer program established pursuant to this subsection shall be supportive and non-clinical. It is not to replace mental health services provided by a professional licensed under Title 26, certified or rostered. Okay, and then subsection D, developmentally appropriate guidance. For any mental health literacy, so that was subsection B, or peer-to-peer support program, subsection C, established in this section, DMH is to develop age-appropriate guidance that, in an elementary school setting, emphasizes social and emotional development, peer connection, and strengthening protective factors. And in a middle and high school setting, emphasizes protective factors, reducing stigma, and supporting students in recognizing and appropriately responding to risk factors and warning signs associated with mental health and substance use challenges, including co-occurring challenges. In subsection E, there's a reporting requirement annually. By January 15th, DMH is to submit a written report to the policy committees evaluating the effectiveness of programming established in this section, including aggregated information on the number of schools requesting and receiving the department support, the number of students, educators, and school personnel participating in programming, and findings and recommendations regarding mental health literacy and peer-to-peer training, peer-to-peer programming. Takes effect this July, and it has a new name, an act relating to mental health literacy and peer-to-peer supports in schools. That's it.
Go ahead, Daisy.
I think on page 1, line 15, we should strike including through federal block grants. I don't think it's necessary.
To change folders.
Says to include, right? So,
No, it says including through federal block grants
Yeah.
and DMH. DMH noted that block grants at this time aren't available for, or are not eligible for this.
essentially, if we got rid of including funds, we're saying the same thing, which is if there are funds available in any way, correct? Through grants or,
Yeah, if you don't
Yeah.
want to take it out, you don't
Yeah.
have to take it out.
no, I'm not. It seems extraneous to me or unnecessary.
Well, they asked to have it removed.
Yeah.
So. And then the other thing to consider is page 2, line 17. Under B, just saying it is overseen by an adult who is not required to be a licensed, certified, or rostered mental health professional. Because right now we're requiring it to be a school professional. And that would require a certain agreement with the school staff and the Department of Mental Health that I think might impede implementation of one of these projects.
So who would be that person if they weren't in the school?
It could be different at any school, right? And I think that's the flexibility that I'm suggesting we open up, because what I heard early on in early versions of this was, there's a lot of difficulty when trying to merge or tell schools what to do, right? Especially with their staff. And I don't want to look like we're trying to do that.
You want to substitute adult?
Yeah, I want to say in line 17, B is overseen by an adult who is not required to be a licensed, certified, or rostered mental health professional.
Wouldn't we be opening it up to any adults?
School appointed adult?
I mean, if you're an educator or school personnel member, I'm assuming you've gone through background checks and I mean, if we just put adult, it could be me. You don't want that. Sorry.
No.
But remember, this is not saying they shall do it, it's saying may establish this, a school may do it.
Yeah, but this is saying that if they establish a mental health program, that they have to have an adult overseeing it. And that adult doesn't need to be licensed, certified, or rostered mental health professional. But it also means that at least that adult has to be a school, an educator or a school personnel member.
So what if Vermont After School wants to do this?
Wouldn't they be a designated educator?
Think so, no. Or a municipality wants to do it through 21C funding in an after-school program. It's still going to go through the school's oversight, or through the Department of Mental Health's oversight and guidance, and they have to stand up and define really the program and parameters.
So DMH has to essentially approve anyways. Oh, they provide oversight and guidance. Okay, I feel bad about that. I just didn't know if it was like rando guy off the street or something like that.
Can I
Okay.
qualify in that?
Because these would be grants, so DMH would have to write what it's called, NOFO or RFP or whatever for a grant. So there would have to be more definition on all of these things by DMH.
Good. Thank you for talking me through that. So go ahead.
So what did you come up with the answer for line 17? Overseen by a designated educator, or school personnel, member who is not required to be licensed, certified, or rostered. I've seen some people in the school system that I wouldn't want designated for that job.
Yeah, me too.
So I think you gotta have something there to protect. I don't know what I'm asking for, but I think we could be opening up a can of worms if we don't put some stipend, with not a stipend, but clarification on who.
I think what Daisy was saying is that later on, next page, it talks about how DMH is going to come up with guidance and the rules around who can establish and how it's established, so that it's like not necessary because DMH will already be doing that.
Should
They
be,
will have to write a grant and define it themselves, and they'll be liable for it. So have you ever met a coach that would be like fantastic for sitting in the room and getting kids together?
then I've seen others that I wouldn't want in that room.
That's right. So I think we need to give the experts the flexibility to define
Right.
what sort of certifications or background checks or whatever those adults need to have. I think they need to be adults.
So do we need line 17 then?
Daisy's
We
suggesting
do-
it's removed, aren't you?
No, I'm
suggesting we
not.
Remove it?
I said B is overseen by an adult member who is not required to be a licensed, certified, or rostered mental health professional. The reason that's important to have is because we do not want this to be construed as mental health counseling, support, any service. And so by articulating that, we're doing two things. One, we're articulating that it's not going to be another youth. And we're articulating that it's going to be overseen by someone, and also that they do not have to be a clinician. So it's kind of doing three things.
Could we refer it to the Department of Mental Health?
It is.
Oh, it is.
Yeah.
No further.
So it's overseen by an adult who is not required to be a licensed, certified, rostered mental health professional under Title 26. That's what you're suggesting. And then when we get down to 2,
Top of page 3,
Yeah.
the Department of Mental Health shall provide oversight and guidance to any school seeking to establish or maintain peer-to-peer mental health program pursuant to the subsection. And because they're grants, the school or the Department of Mental Health, I don't know if you've ever seen their RFAs, but they have to meet. What?
Very specific.
Yeah.
I've got Topper and then Karen.
When you use the term adult, Daisy, how do we define that?
I'm looking at Katie.
Oh, sorry, I'm answering your AI, I'm working on your AI issue. who is an adult, somebody who's reached the age of majority, so somebody who's 18 years of age.
You would qualify, Tucker.
I know, that's what I thought. When I was listening to you, you said an adult number. Was it member of what?
Take out.
No, she's taking out member.
Yeah, no, just an adult who's not required to be a licensed certified. Sorry, member was written there and I probably read it, but no.
Okay, so, this can be anybody that's 18 years old or older, correct?
The Department of Mental Health is going to define that more closely.
The
We are
Department of Mental
requiring-
Health is gonna define what the adult, what it means.
No, we are saying they have to, the Department of Mental Health is gonna have a grant program.
Yeah,
They're gonna oversee it. They're gonna report to us every year on who participates and the outcomes. And they are gonna do it through the grant program as funding is available. This bill has no money in it. It's just creating a pathway. So if the Department of Mental Health gets a federal grant earmark from Bernie, please, anything like that, there will be this pathway and the Department of Mental Health will have a mechanism to develop a grant program, define who these adults are. And we would have to be making that appropriation anyway, so we will see it again.
so you're saying that everything is gonna be, described in the grant.
Yes,
Yeah.
but I don't want to be too tight. I want to let the experts define who they think is qualified to work with this.
Okay,
I agree with you. Sometimes we can get too prescriptive and we have to let the people who are responsible for things develop the appropriate stuff, and it's not really, we're the policy, not the no gardens in statute.
Yes.
Gloria's laughing. Karen.
Yeah, so Daisy, when you get to section 2, top of page 3, it talks about mental health, environmental health, providing oversight and guidance to any school seeking. But you have a really great application for after-school programs and then, including that broader concept. Does that, just thinking about that, does that any school encompass after-school programs necessarily, or just bring it back?
Oh, yeah, we would have to expand that language.
We talked about that last time.
We did.
Yeah.
Do we want to discuss that?
Yep. He's focused on something else.
Yeah.
Well, it's okay.
I'll circle
Katie's
it.
jumping to peer-to-peer.
Yeah, because the person who came from the after school, we were saying,
Yes.
could they apply for a grant? And that was,
Yep.
we didn't solve it, but.
Thank you, Karen, because we were going to talk about that.
You're in C1A, supervised school setting. Is that where you are?
I was at page 3, line 2, any school.
It could be beyond school. That was the conversation we had before.
Oh, I think it would have to be changed in both places.
Yes.
Is that something that people are generally in agreement with? We did hear testimony about the after-school.
Not because, it would consider that school's only been 180
Yes.
days a year, and what about summertime? And can there be programs supported by DMH?
Yeah.
And they're all
Will support you.
programs like this. They will
That was the conversation.
Is there general agreement that people would like to include that in this bill? Yeah. Okay, so we would have to make 2 changes in 2 different places.
And Katie, I don't know, page 4, line 1, the number of schools, which is number of schools and at that point. Third place, page
That's reporting.
4, line 1, the number of schools adjusted.
Reporting.
That's the government. Yep.
Number of schools and after-school programs.
So essentially everywhere where there's says schools.
Yeah. Page 3, line 13. Or all those, what about all those age-related ones? Maybe
That's a
Those
different
don't-
program. Well, that could apply for both. Hold on, I have to go back. Page 2, lines 15 and 16 provide structured opportunities for student peer connection in a supervised school setting. Would it be broader than that if it's an after-school program?
Yes.
Yes.
If DMH is okay with that. You haven't had a chance.
Supervised school setting or
probably-
after school program. The supervised school or after school setting.
Get a look, folks. Right.
There.
Oh,
Stephanie said.
oh, did you want to comment? Did you want to comment, Stephanie, or?
I'll take it back that.
Okay, all right.
I guess the issue is not just after school, but not when school's not in session or,
Right, summer.
summer program.
But after school encompasses that. That's how we have interpreted after school, that it could be like school vacation or summer.
Down the hall. Al,
This seems to be more of like a decision between a school and a department, but someone approached me and asked about parental consent within, for the program being instituted in the schools. Is that something that?
It was in an earlier version, so maybe that's why they're thinking about it. And it was in the earlier version because in that one, it was proposing that each school union or supervisory union select a curriculum for mental health literacy. And that parents had to be notified that and the curriculum had to be made available to them. But this version explicitly says you cannot force any school to adopt this. The school has to apply for it. So, and the parental consent, yeah, I don't know. Are you thinking that?
I think they would just want to know that it was. I mean, an example, there's. The class being administered in one of our schools and the mother didn't agree with like the illustrations in one of the books, but she did her homework and saw it. It's just more of like, well, they know that it's going on once the school adopts it. As a parent, you know, big looking. That was.
Yeah, I don't know if it's I know certainly for after school things, parents have to sign up for participation. I don't know that we can mandate a school to notify, because this isn't a health thing. There's no health stuff done, and I know we received a letter citing a Supreme Court case that basically tracked to a gender, a youth that was having gender dysphoria, and I just want to clarify that gender identity is not a mental illness. So although this is a mental health bill, that does not apply. Gender dysphoria is, the stress that someone might have if they're, experiencing being in a body that is not what they were assigned at birth, but that is not technically classified as a mental illness. So this bill does not deal with that.
thank you. Great. Let's see, so we have a couple changes that Katie has to make on this bill. Any other questions on this bill? How's 816 going, Katie?
Not well.
Not well.
Yeah.
What do we say about tabling both these bills for overnight and then trying to find 15 minutes of Katie's time tomorrow? And then we vote on these two tomorrow. Give everyone some time to sit with them a little bit. Give Katie time so she's not flip-flopping back and forth.
Can we wait until,
And we want to hear testimony from the written testimony from kids.
can we vote on 8/17 on Friday instead?
let's try to we'll find time for Katie on
I
Friday.
have some time Friday morning.
Yeah, perfect.
And I do have a draft, like a 2.1 of H17, if you wanted to just look at the changes you just asked for.
Sure.
Okay. Okay. So the first change here, yeah, was to get rid of the language about the block grants, so that is gone. Gone, so there's nothing there. And then in subsection C, a school or after-school program may establish a peer-to-peer mental health program that provides structured opportunities for peer support connection in a supervised school setting or after-school program. Maybe, how about a supervised school or after-school setting?
Yeah.
Okay.
A typo was there.
Yeah.
Okay. Is overseen by an adult who is not required to be licensed, certified, rostered mental health professional.
Like an appointed adult or something. It just seems so underqualified at this point with just adults.
Yeah, but I just want to remind you,
I know.
DMH is going to make the qualifications, not us.
We say as per section 2 or whatever.
That's kind of what section 2 says.
It does, but since people are gonna struggle over that word, or not really need that, it's not adequately supervised, then we're saying department, that gives them the clarity, or gives the rest of the world the clarity.
If you want to use that concept, I don't know if I'd put it there, but in 2, you could say shall provide oversight and guidance to any school after-school program seeking to establish and maintain peer-to-peer mental health program pursuant to this subsection, including qualifications for the adult. Yes.
Yeah, great, Katie.
Including, I just don't know how to say that, including qualifications of the
Designated adult.
adult. Designated
You took out designated, we shouldn't.
of the
How about an adult pursuant to
of the adult
and reference?
of the adults. I'll figure it out.
Okay.
I don't want to waste your time.
How about the overseer, since we say is overseen?
Or the individual overseeing.
Including requirements.
Background check.
No, we're not going.
So I think adults.
Okay, I'll figure it out. And then I've changed this from school. So this is the developmentally appropriate guidance. So shall develop age appropriate guidance. I'm gonna get rid of that. For elementary age children. That this is where the that goes. And then the same thing for middle and high school age children. That emphasizes.
Should you say students instead of children? I don't know, once you get to secondary.
Youth.
It's youth, yeah.
Okay, you.
Are elementary youth? Or are just middle, high school? I don't know, what's a youth?
What's a youth?
Like a movie?
My favorite movie.
Oh, yeah. House.
Okay, no.
Or you don't know, oh, it's the best movie ever. My cousin Vinny.
Yeah.
Oh, I've seen my cousin.
Okay, sorry, I did that.
You know what?
Great. And
If we have this wrong, guess what? It's gonna be downstairs.
then the reporting requirements, including the number of schools and after-school programs requesting and receiving services.
So remind me, maybe? The idea that, organizations other than schools can apply for the grants, that we're waiting to hear back, is that where that landed?
We're gonna wait, we're gonna ensure that DMH comes back to us to make sure that they're A-okay with after-school program.
Applying for grant.
Yes.
Okay, that's it.
Okay.
Sorry, you're watching me type.
Any other questions on this? Because I do want to take a break before we go into 2:30 and we're whittling down our time.
Okay.
Go ahead, Karen.
So quickly on H816, there's two places where generative artificial intelligence is found.
Oh,
Like that.
okay.
Gotcha.
I'm sorry.
Different bill.
I switched bills on.
Oh, okay. I don't think that one is mine, is it?
No, it's
Okay.
the 817,
816.
16.
Oh, 816. Yes, there are two places.
Yeah, okay.
I think there's a lot of work that maybe has to go
Yeah.
on behind the scenes.
Okay, so let's take a break. We will get Katie scheduled for whenever she's able to get in here, and hopefully Friday on this one. And then let's take a break until 2:30.
Yeah, anyone.
2:30, and we'll be back here at 2:30 to go back to 585.